So, how has Contra Costa prepared you for your future career as a primary care physician?
First, I just thought I'd mention that we have 3 different clinic sites that we work at, and you're assigned to your continuity clinic at one of those 3 sites. They're all within the county, but each have slightly different patient populations, just based on like the distribution of people throughout the county. But you still get a great variety of adults, of prenatal, women's health, of peds at all of the sites. It's really great because you really get to know your co-residents at that site. There's a little friendly like interclinic competition, and you really get to know like the MAs and the other folks that you're working with, and it just feels like another beautiful extension of our community. So I really enjoy it.
In every clinic, a lot of our patients kind of treat us like an urgent care. And so you never really know what's going to walk in the door. Sometimes you might be draining an abscess, you might be doing an acute coronary syndrome workup, you really never know, or you could be linking someone with mental health. And it's just the whole spectrum of everything. And, you go from seeing, which is, true in a lot of family medicine, but I think just in any given day, I'm always amazed at the variety of what walks in the door.
One thing that I appreciate about our continuity clinics and our outpatient experience is that it's protected from our inpatient duties. So even when we're on a hospital medicine rotation, for example, as intern, I have one full day of patients that I see continuity, and I'm not expected to round in the morning or round in the afternoon or do any of my inpatient responsibilities while I'm taking care of my outpatients. And I think that's really important and speaks to the commitment that Contra Costa has to training us in both inpatient medicine and to be really strong outpatient providers as well.
Everyday clinic is so different, and we have a great mix of chronic disease management, taking care of older adults as well as prenatal patients, and then following our continuity prenatal patients once they deliver and having visits with newborns and moms together. As well as I think we have a fair amount of pediatrics, well child checks, as well as follow-ups for those visits. And I've really appreciated my primary care training here.
There have been multiple times in clinic where attending from who's doing their own continuity clinic comes over and says, I have a procedure, is there a resident that can help me with this? And they get to walk you through it. You get to do the procedure yourself. That goes on your own log, and it's just a really cool piece that they are always thinking about your learning, even if they're not working with you directly.